Hi, I'm Dr. Kimberly Moore, host of the Envision More Workforce Insight podcast. Join us as we explore workforce and leadership through an innovation lens with leaders from across the country in every industry. Whether you're in education trying to crack the code for workforce or industry seeking to address your workforce talent strategy, or maybe you just need to be inspired, we've got you covered. Tune in, save us as a favorite, and let's innovate together. Welcome to another episode of Workforce Insights, the podcast that brings together not only education, but government, private sector, and nonprofits. Leaders, we hear their voices, we understand just the important issues that matter most to them, but we also identify connections. And today's guest is no different. An amazing leader in her own right, and I am certain listeners across the globe, yes, we're in 10 countries now, that you will find something that you want to replay over and over as well. So Charlene Zein, thank you so much for joining us today.
Yeah, I'm so excited to be here. Thank you so much for having me.
I know, we always like to unpack and do some, I call it the rapid fire or icebreaker questions to kind of level set with the audience. And today's no different. If you could solve one big workforce issue with the snap of your finger, what would that be?
I would solve clinical capacity and nursing shortage. I know it's a big, heavy, meaty topic, but you think about aging in place, you think about the aging population, you think about kids with special needs, you think about all the in-home care delivery. And in my line of work and in the Medicaid, Medicare, and ACA government-sponsored program life, that's the life I live. One snap of my fingers,
that's what you're fixing.
That's what I do.
And the world loves and appreciates that. What's one innovation in managed care that you think is an absolute game changer?
I think that safe and appropriate application of AI is going to change the landscape in every industry. And I'm not talking about like where people are demonizing it, like it's so bad for, decisioning clinical things. No, not that. But just making our lives more efficient, making our people, the humans that are reviewing and doing things, making their life easier. That's where I think, AI can really be brought to bear and expand the capability and making sure that people are operating at the highest level of skill they can.
I know listeners, you're probably already getting the same feeling that I am, that this is going to be a great conversation. She is fearless in her own right and ready to take on the world. One last icebreaker. What's one word you'd use to describe Florida's healthcare future?
Exciting. I think it is a dynamic and exciting place to be. I think it's always going to have its challenges and opportunities, but I think that we are sitting at the precipice of a massive shift, and to be able to support as many people as we do on a day-to-day basis is an honor and a pleasure.
Oh my goodness. Okay. Now we learn even more. When I think about it, Char, there's over 2.5 million members. Sunshine Health plays a critical role in Florida's healthcare ecosystem, a major player. How are you positioning the organization for future workforce and care delivery needs?
Yeah, I think there are a couple things. We have Sunshine Health Works with it, which is, of course, our cornerstone workforce development program. You are very well aware and involved in helping us with that. But, I think that that's really a launching point, a jumping off point for getting us not just talented and training and getting people exposed to what life in a care delivery system can look like, but it also maybe puts people on a path to future clinical roles that they never would have dreamed of otherwise. And some of that also supports our actual members on our Medicaid or other product lines getting to self-sufficiency and eventually graduating from Medicaid, standing on their own 2 feet and supporting their families in a way that maybe they didn't even think was possible. So putting people into a funnel and exposing them and educating them to all of the different opportunities, and then supporting them financially, because sometimes that's the barrier to entry for many of the people that we support, right? I can't afford to take the test. I can't afford to take the training. But removing some of those barriers is one of the key focal points of that program. And then partnering with not just training, but places for them to land and be employed once they are trained, once they do pass that test, is really the ladder that we're trying to help people climb in our workforce development program. So that's one area that outside of like what you think of health insurance is such a key part of how we move forward into the future, not just of like our Medicaid contract, but of the industry.
I love your passion behind Sunshine Healthworks. Listeners, think about this. Healthcare is so critical, of course, to our wellness, but also financial stability. The fact that Sunshine Health is a leader in the state of Florida and a best practice for other industries to look at and model their efforts. I mean, this is amazing. And I would encourage you to definitely not only follow Shar because she is amazing, but follow the work as well and Sunshine Health Works and how it's impacting Floridians and every corner of our state. Shar, how do you build and retain talent? Because again, so many, I can understand why folks would want to be a part of your team, but how do you build and retain talent in a sector facing growing workforce shortages?
Yeah, I think, there's a super famous, everybody says it, kind of cliche quote that, culture eats strategy for breakfast. And I think that it's more than just the words. It is an ongoing, ever present, purposeful culture focus and how you want people to experience their jobs. Like it's not always going to be easy. We're not always going to get it right, but people come to work to do a good job, and believing that in your heart of hearts is part of like one of the cornerstones, I think, of our culture. We also bring a culture of service mentality. So I expect teams of like from frontline all the way up to like me to be giving your time to the communities that we live in. Volunteerism is a really big part of our culture, and taking time away from the actual work to support our communities is an absolute need. I think that the other thing is transparency. So I am who I am. If you ran into me in a Publix or if you ran into me in the street, like you would get a similar version to who you see at work, because that is, you bring your authentic self, and I encourage everyone to do that. So I think that just like making sure that you understand and are listening to, I listen, we do surveys here every month, and I read every single comment. I want to know what the problems are. I can't fix things I don't know about. I want to make sure that we are identifying trends and themes so that we can communicate better or differently. And I really do think that culture is the key cornerstone to having people want to come work here, want to stay and do the hard jobs, because these are very difficult jobs. And also know that there's growth, there's trajectory, there's places for them to go and be themselves at all times, but also to serve members, to serve providers, to serve stakeholders across the state. So I think it's really about a focus and an intention on building a culture that attracts the right talent and makes people want to stay.
I love it. Attract, recruit, and retain. But again, I think audience, please do take this into consideration that not only is Sunshine Health doing that internally, they're focusing as much externally on growing that workforce for their members, partners, and just industry overall. I mean, they are a lead partner in driving workforce. So again, when you think about, rapid healthcare transformation, what strategies are you using to foster innovation and operational efficiency? Because again, there's so many things out there. We've talked about briefly about AI, but how are you fostering innovation?
I think one of the special things about Sunshine is, we're open to failing, right? To trying new things and to fail fast, learn fast. And one of the things I think that, I try to bring and take to heart is, we don't win or lose, we win or learn. And so winning together, celebrating those successes, all that stuff is really, really important. But I think like in terms of fostering innovation, it's allowing people to try things. It is demonstrating that we are all human. We should absolutely be piloting and then measuring, and then, oh, that's working, let's do more of that. Oh, that's not working, let's move away from that. And just doing that in an ongoing sort of continuous way is one way that we absolutely, encourage our teams. Bring ideas. There are no dumb ideas, there are no dumb questions. Like, let's try it. And I think in healthcare, especially as heavily regulated of an industry this is, it is hard to continue to try to think outside of the walls and the boxes that we know that are comfortable for us. So just having, a spark and a spirit of like, oh, tell me more about that, a curiosity, and continuing to allow space and time for teams to do that, both together and apart, and then bring those to places where we can say, "Ooh, that sounds like that's a really great idea. Let's see how we can make that come to life." And people love to see their ideas come to life. So giving, that place where we foster new ideas, we evaluate whether or not how we make them work in our, regulatory boxes, and then we see what happens. And some of that is through partnerships. Again, you mentioned we have a lot of those. And some of it is, our own internal like teams trying to do things even slightly differently, which can make a big difference in how people experience their work life and how our members and stakeholders experience working with us.
Listeners, again, important points I'm sure mentioned about allowing space and grace. Two important pieces when you're thinking about innovation. And Shar, being the leader that you are and the journey that you have traveled, what skills do you believe will define the next generation of healthcare leaders?
Oh my goodness. How long do we have? I genuinely think that, there's such a focus on like learning and being trained on specific things. And I think that those hard skills are really important, right? We should know, if you're going to be in project management, you should know like all of the things that you need to know. But I think like the soft skills are equally important, especially as you move up and you think about like how your leaders have interacted with you, how you would want to be interacted with, and how you model behavior you like and how you leave behavior perhaps you're not a fan of. I think skills wise, like self-awareness is the most important like indicator of success for me. A constant like desire to be better that starts with you and not with everybody around you and the terrible situation you find yourself in. And it's also, a constant desire to learn and be curious and not stop at no. You got to kind of know when to stop, right? But that first no is just, it's an appetizer. Is it a maybe no or is it a no? And I think just beyond self-awareness, a constant curiosity. And then there are transferable skills. I like to refer to a toolbox, right? Like every skill that you put in your toolbox is yours forever. Nobody can take those away from you. So learn everything you can, expose yourself to everything you can before you sort of like decide that this is your, path forever. So I like to say like inch deep, mile wide, and then you can decide which pool you want to be your deep end, because you can always learn more about any topic that you want. And I think that just again, wanting to know, being able to connect dots, being able to see the big picture, but also get down in the weeds and execute, like those types of personalities and skills translate industries, they translate across like any different job that you'll have. And it also translates like up and down as you move through your career.
So again, for listeners, I'm thinking about not only emerging leaders, some great skills to have about being nimble and also continuing to learn. I call it learning for life, really doing that. But for those of you that may be thinking about a second career, thinking about healthcare and the skills that you have that you thought were just single focus on one sector, you're hearing firsthand with Shar that no, they are actually portable, they're transferable. So think about a career, and not only think about a career, think about an opportunity with Sunshine Health. They may have some great ones that have your names on them. So, Shar, how do you align Sunshine Health's mission with workforce performance and equity goals?
Yeah, I think, our mission has not changed in decades, right? We are transforming the health of our communities one person at a time. And aligning, your workforce to a North Star that is member focused and community focused is actually not difficult, right? We are all, the majority of our team, that all, 3,500 employees, the majority of them live and work in Florida. So we're Floridians. And so aligning to like helping your neighbor and helping your community is actually easy. That's the easy part. I think with all of the competing priorities, with all of the external pressure and the internal pressure and the prioritization that needs to happen, the more difficult part is like keeping people aligned to what's the most important thing right now. And again, that comes back to like culture and transparency. So when I think about how we keep all of the people in our vast and wide, not just our Sunshine family, but our Sending corporate family, it is really important to make sure that we're communicating clearly, concisely, and then frequently with all levels of organization so people are informed, feel connected, and again, remain connected to the mission outside of the day-to-day work of, and how we actually in support and drive outcomes for members and their families.
I love that. I mean, and what you're sharing with us is that you absolutely can do both. You can certainly lead with intention, but also care and operate with heart, and you're doing that. What's been your approach to cross sector collaborations, especially with education and government entities, to meet Florida's growing healthcare demands? Because again, you all are taking a lead role.
Yeah, we are, again, it's intentionality, right? We are intentional about the community partners that we have. We are intentional about the relationships that we build, foster, it grass grows where you water it. And so we very much enjoy and focus on how we bring all of our partners to bear. Again, whether that's a community partner, a government partner, or a regulator partner, a legislative partner, we really do target not the people that we think are going to be most important to us at the time, but in the entire continuum of healthcare delivery and beyond that into health related social needs. We can't deliver all of that in our own four walls. Nobody can. And so having deep and steeped trusted voices in the communities is really how we get, members to take action or outcomes to be improved on the health side. And some of it actually isn't targeted at health at all, right? It's workforce development. It's, hey, you need a housing support, you need a rent support, you need a food support, like whatever those supports are, like we view ourselves as connectors for members and families to the resource they need, not necessarily the providers of that resource, which is another reason that those cross sector relationships are so important and they matter. We have, school partnerships because some of our members receive services in school. We've got sheriff's office partnerships because some of our members we are difficult to locate, and we want to be able, when they're engaging, if they're just as involved or adjacent, that we have an opportunity to grab onto them and engage with them, with our care management team or with our field-based teams. So I think that what you'll find is like it's really a web. It's a quilt of supports, and that's really what it takes. We hear it takes a village. It takes a village to raise a kid. It takes a village to do. It takes a village to make sure that we're catching all the people and not letting needs fall through the cracks, especially needs that can then generate and turn into larger or deeper end, like hospital type needs, when we can catch them when they're sort of like in the PCP or doctor kind of space. So just thinking about prevention, thinking about how we, weave together the engagement and connectivity of the people that we serve.
I love it. A safety net that is really standing on the shoulders of so many different partners. I mean, I love that. How has your background in strategy and planning helped you lead through uncertainty and change? Because I imagine healthcare, as you mentioned, with all the regulations, but it's a huge role. So, how has your background in strategy and planning helped you?
I think that it helps me in like zooming out, because I personally know that I have a tendency to be like, what are we doing right now? Like what needs to be executed on right now versus like, hey, 6 months and a year and even, further down the road. And so that helped me sort of zoom out and say, okay, well, if we want to be here in 5 years, like what do we have to do? Where do we have to be at the end of year one? Where do we have to be at the end of year two? And candidly, like a lot of that, like the zooming out it's not a me thing. Like I have surrounded myself with a team that is not me, intentionally not me, right? Fills my gaps, sees my blind spots, helps us be positioned, not just for today and what needs to happen today, but for the future. And so I think planning, strategy and planning, like goal setting, I have a lot, again, my self-awareness, I have a lot of energy around getting things started, bringing the right people together, getting it off the ground, getting it into the air. And then after that, I'm like, yeah, we did that. And I'm like, tell me how it goes. So I think that again, like the planning and the liftoff part, super exciting for me. But I've got a bunch of people that are really good at once the plane's in the air, we're just going to keep it in the air. And we're going to make sure that it lands, we execute it. So, I think it's as much me as it is the team around me. It is, again, keeping the people informed so that they know what they need to be executing on and prioritizing. But, there really is like a whole team effort that goes into all of it. And I think, my one of my superpowers is just like zoom out. Who needs to be a stakeholder in this conversation? How do we get them together quickly to make sure we have a well-rounded approach and not like just what I think is right? Because let me tell you, so very much rely on my team of experts. That's why you have a team. If you wanted to be a dictator, you don't need a team to be so just leveraging everyone's strengths, understanding, who has a good view or expertise in certain things. And that's part of, I think, strategy. I think that's part of planning is, as you look at your, chessboard, it's a bad euphemism, like people are not chess pieces. But, as you look at all the things that are at your disposal, whether it's, a partner or a team member or a stakeholder, and just bringing those to bear at the right time is one of the like balancing acts that I do every day.
And as you mentioned, is a superpower. So when it comes to data and technology, what role is it playing in transforming your workforce and improving patient outcomes?
Oh man, we live and die by data, by the data's like integrity, by what it tells us, by how it helps us make decisions. Like everything that we do is enabled by data. So, like when I think about the number of care managers as an example that I've got to hire, like all of that is driven by data. What's my pipeline? How many do I need to hire? Where do they need to live? Like all of those insights are how we make decisions and the basis for any decision we make. So we look at trends, we look at, hey, how many people are graduating? Are they staying in the state? How many people do we need to put in this funnel to make sure that we're set up in, a couple of years? But I think that like data underscores everything we do. It is the driving force between, in how we make decisions, but it also helps us try to stay at least half a step ahead of what's happening and what's coming our way and preparing, our either our workforce, our recruitment, our, different pieces of that puzzle and getting those things prepared as early as possible so that we're ready for whatever comes next. But yeah, data is it's the thing.
Data is the driver. Oh my goodness. So I think about it. So we got the data and we're talking about strategy, but then there's this people side of it. So as Florida like continues to evolve demographically, how do you ensure your workforce reflects, the communities that you serve?
Yes, ma'am. So this is another sort of passion of mine is making sure again, like our care management teams are culturally sensitive, competent, trained, but beyond that, like speak the language that our members and their families speak. Florida has so many different from the panhandle to the Keys, we've got 18 different communities of people speaking 18 different versions of language. And so making sure that we know what is in each of those cultures at a both macro and micro level is really important. Being able to relate to people, communicate in their language is like one other piece that really amplifies engagement. If I can't emphasize enough that we very much focus on being representative, not just in our frontline team members, but as we go up the leadership chain, we keep an eye on all of that. We look at not just like, female male splits, but we also look at how as we go up in our organization from a level perspective that it still is representative of our overall employee base. Because again, as much as members want to be, led by and consulted and cared for by people that know them and are like them, we want to be led by people that understand us, that, when we want to see faces that look like ours in roles that we want to have one day. And so, I think especially as, a female leader organization this size, like it's very important to me that people can look up and over and down and see somebody that looks like them and latch on that, like, look, she did it, he did it, they did it, I can do it.
I can do it too.
And so there's proof in seeing it more so than just sort of saying it. So it's like, don't talk about it, be about it. And that is really an important piece of like our recruiting and our hiring strategy.
I love that. And you said that so beautifully. And I can't believe that we're nearing the end of this podcast with one last question. So listeners, take note. So what is one leadership lesson from your time as CEO that other executives across any sector can learn from?
Wow, man, that one's a little bit hard. Just in narrowing it to one, I think is the hardest. As you can see, I have a lot of words. And so again, an old adage that I am still working on is listen twice as much as you talk. And again, as a leader, people are looking to you for direction, but I learn every day and I learn it from team members across like my enterprise and not just my team members, from people, because everyone's got a story, has a different background, has something to share that will be new to me, news to you, news to anybody. And so I think while people expect you to, be a decisive and be the talker, I think, I get so much more out of hearing how the team arrives at the same place that I would arrive. Because it shows you how people think. It tells you a little bit about how they approach problems, and they don't always solve them the same way I would, but there are many different ways to get at, there are many different ways to solve the same problem. So just having a active listening, not just listening to respond. One thing that I think is a lesson that I'm still learning, candidly, but it is sort of always in my brain as like, don't talk, shh. And I have to consciously like hold myself back from being, this is how I think we should do it. So I don't stifle ideas, because listening also encourages people to speak up and share their thoughts. And diversity of thought is how we continue to innovate and evolve.
I love that. I love that you were totally transparent in that it is absolutely a journey that we all find ourselves on. And I will most certainly call that the drop the mic moment. So I want to thank you, Shar, for joining the Workforce Insights podcast. And listeners, as always, thank you for continuing to grow our listenership. Please do share it. Please do forward, like it, all of the above. And thank you for making Workforce Insights a global listening spot for leaders. Thank you. Until the next time. Thanks for tuning in to the Workforce Insight podcast, powered by Envision More Consulting Group, where we bring your bold visions to life. Remember to subscribe, share, and stay tuned for more insights on navigating the world of workforce and leadership. Until the next time, be bold, be great, and let's innovate.